Okay.
I have a capture.
Welcome to everybody online to this evening's sports medicine workshop. Tonight we're going to be talking about wrestling, injury prevention, and common injuries. Also, if we have time, we're going to have a bonus session I think you'll all enjoy. If folks who are live need to use the restroom, they're just outside the door here along with the water fountain. Everybody online is muted. If you do have a question, please send a chat to Chrissy Bruce. You'll see my name in the chat dialogue. And now we're going to turn it over to David Arakawa.
Thank you, Chrissy, and thank you, audience, this evening. Welcome to what is our last workshop in the 2016 Sports Medicine series. Tonight's topic is going to be, we're going to avoid injuries and become the champion of the mat. A little bit about myself. I am a former wrestler. Sorry, I'm trying to get the answer.
Not working?
That's okay. Yeah, I'm a former wrestler. I wrestled in middle school into my sophomore year at high school. And then I decided to take away from sports and I went into academics. So I'm very passionate about wrestling. I love working with combative athletes. It's one of the things I like most about my job. I'm also, as well as a treating physical therapist, I'm the management coordinator here in Walnut Creek, sports medicine, and I'm also the management coordinator in San Ramon. So we'll get to our centers here in a moment. So just to let you know, the sports medicine center has these various departments where we have orthopedic care, we work with, we have the sports medicine centers, again, we have athletic training services as well as, excuse me, an athlete development program. We have a pretty robust dance medicine program as well, and a sports concussion program. And we also have a motion analysis in the sports performance lab here in the Walnut Creek campus, and we utilize that service quite a bit with our rehab athletes. We also have a sports nutritionist on staff who helps us out a great deal with our athletes. And then we do a lot of community outreach. As you can tell, we're doing our lecture series, and we do a lot of injury prevention as well. So some facts about our Sports Medicine Center. We have 4 facilities right now. We have one in Oakland. We have one in San Francisco. We have one here, obviously, in Walnut Creek. And then we have our San Ramon clinic. We are the largest pediatric sports medicine center in Northern California. And since our inception in 2004, we've worked exclusively with young athletes to manage, rehabilitate, and prevent sports injuries. Because we work with young athletes, because their growing bones and their cartilage are susceptible to injuries, so we have to treat them differently than we would the adult population. And then our main objective is, first and foremost, just to facilitate the child's quick and safe return to whatever sport they enjoy doing, and we do that through ongoing education and training. So we offer physical therapy services, and one of the things I like to do is tie that into what the other services we do. So let's say we take a patient into physical therapy, we evaluate and assess them, and we come up with a problem list, and then we produce a treatment plan in order to work on those problems. And then at the end of physical therapy, what we try to do as best we can is we try to integrate them into our sports training program, which is our athlete development program. Because in physical therapy, what we do is we pretty much are working on restoring physical qualities. Whereas when we're doing advanced sports training and athlete development, we're trying to actually develop those physical qualities. And like I said, the motion analysis and sports performance center we have here on campus, I'm sorry, I'm walking back and forth. We utilize that service when we're rehabbing our athletes, because a lot of times we could sure use their technology, because they use 3D motion analysis technology to assess movement of our athletes, and it's very, very beneficial for us. So, and then we do a lot of injury prevention and sports performance as well. All right, so these are our objectives tonight. We want to discuss what are the 4 factors that we see that affect the level of injury in wrestling. And then we also want to discuss what are the strategies that we can do to reduce the risk. This is a great quote, and you probably know if you're in the world of wrestling, the one and only Dan Gable. He says gold medals aren't really made of gold. They're made of sweat, determination, and hard, to find an alloy called guts. That's a good one. All right, so what's our risk? We know that wrestling ranks on average third highest in overall sports injury rates. Okay, the average time lost in wrestling is about 5 days. Average number of practices is about 4, and average number of missed matches is going to, competition is about 1. You miss a match or a competition when they get injured. One of the other big risk factors is the defensive position. During takedowns, the defensive position is at risk because they're looking at all those high-intensity, large forces that are coming at them from the opponent and the offensive person. There's about 68% of the injuries occur during that point in the wrestling match. Another risk factor is the longer periods spent participating in practice versus the actual competition or meets. Live wrestling versus doing your technique work. If you're doing a lot of live wrestling in practice, that tends to increase your injury rate versus actually working on your technique. And we found higher injury, some studies have shown that higher injury rates during competition are actually most, but the rate is actually more in practice, the 68%. I'm sorry, reverse that. The injury rate is during competition, but the most injuries happen overall during practice. I switched that. Sorry. And then another risk factor we have is the different forces that the body segments have to tolerate during a wrestling competition or wrestling practice. The neck here, it's due to like a lot of what we call axial loads or direct force. And you can see on that picture on the far left, that wrestler's landing on his head. So any force that's going to go through that head hitting a mat is going to put a lot of force through the neck. We see the shoulder a lot where you're falling onto an outstretched arm there, or there could be a direct blow to the shoulder. And that's the middle picture down there shows that young man in the red singlet getting ready to come down on his hand, he can sustain a shoulder injury. And then the knee and ankle there, due to the rotational stresses on the knee, you can see that far right picture. The gentleman who's going for a takedown is looking at a lot of stress in that knee area. So I broke down the percentages. The reason why the neck and the shoulder are 42%, I kind of combined them because the studies looked at the neck and the shoulder, and they represented 42%. So I didn't want that to be misleading or confusing to you. And then 23% was for the knee and the ankle itself. So another risk factor is equipment. You want to have the right kind of equipment, the right sized equipment. So headgear. We've got a lot of kids that we can see. If they don't have proper fitting headgear, that could absolutely kind of like play a role as when you're going in during practice or during competitions. If it's not like fitting appropriately, if it happens to slide one or another, a lot of these headgears can cause some facial injuries and some other problems. The mat, that middle picture, I don't know if you can really see it closely, but that's a picture of a mat that's really wearing down, and you can see the cracking in the mat. And if it gets too bad, I remember when I was in middle school, we were wrestling. We had some worn down mats, and we had a couple guys that actually would step into the mat and we'd catch a crack or something. We'd actually roll a joint, whether it's an ankle, we could tweak our knee. And then on the far right, that's a good picture I like. Wrestling shoes. You got to make sure your wrestling shoes are fitting well too. If you are wearing too big wrestling shoes and you have a lot of room, it's a lot of room for the foot to actually move in ways you don't want it to. So the strategies, I went through the risk factors, and so now we got to talk about what are the strategies we use to reduce the risk. My big thing is training. If you can train at certain parts of the wrestling season, and this could be from your preseason, weeks before, during the season, and even after, once you've taken your active rest after a wrestling season, and you get back into like your off-season training. But training in itself, I think, is a really key component. Because if all you do is wrestling, it's like any other sport. If that's the only thing you do is the sport itself and the technique work, you're really missing out, I think, on like developing those physical qualities that we want. So what are the strategies? We've got strategies here. We want to design and program power explosiveness during the preseason. So the way we're going to do that is we're going to do these different exercises. I'm going to go through these with you and describe to you, okay, well, why would we choose to do these exercises? So let's demonstrate the first one. So this first one is called the chest pass with medicine ball. And we found that the chest pass medicine ball throw, it's really good for handling those forces that we talked about during the takedown and also like the following position. So if I were to take a med ball, Chrissy and I are going to do this. Right, Chrissy?
Sure.
Now, what we're doing is, so as a training exercise, what we're going to do, you can see me. So what I'm going to do is, I'm just going to like just pretend, and you got to realize when you're doing training, you're putting full effort into this. You've got to make your training maximized, and that's the way we're going to do this. Is if I'm standing here and I've got my base solid, I'm going to go ahead and chest pass to Chrissy. Now, when she catches it, she actually wants to kind of take it in and absorb that because she's going to have to do that as a wrestler. If I'm shooting in, and remember we said at the takedown position, that defensive position is very vulnerable, you've got to be able to absorb that force and the intensity, and that's why we're using this exercise. So if she comes back, I've got to like absorb that and kind of take that in. If I wanted to go into more of like a traditional wrestling position, I can do that and do that same thing. So we just chest pass, and she has to absorb it. She comes back, and I do that too. You can modify the program, positions, you can get as creative as you want. Bottom line is you've got to make sure and pick an implement that's, good enough where you get that good training effect. You don't want it to be too light, although that could be good for like speed. I'm working now on these strategies during the preseason on power development. So I want to make sure that I can get explosive power with an appropriate weighted medicine ball. Okay? So our second one we got on there is a backward throw with the medicine ball. And what we're going to do is not hit the ceilings. So what I'll do is, Chrissy will stand behind me, and what I'm going to do here is, I'm just going to, again, I can start my squat position. I can go ahead and get into a squat, and I can explode through the hips, throw the ball over my head, and then I can go ahead and catch it back, and we can do repetitions of this. And as my partner, Chrissy could do that. We could she could turn around, could just take turns doing this. But the reason why we like doing this exercise, and again, we can go here. The reason why we're going to do this exercise is because I want to get used to getting in, and it will help me go ahead in the takedown position. And if I wanted to actually work on throws and stuff. So I think that that's a really good exercise to work on for that. Power drops with the medicine ball. Now this one, what you have to do is, and we're going to be careful with the chair here, is Chrissy would be standing on an elevated object. It could be a box, it could be a bench, okay? And then what I'm going to do is I'm going to lie down. If you can see me here. Got it? Yes. Good. And what she'll do is we'll go ahead and simulate this, because now realize she would normally be standing on a box or a chair, and if you just come around, you don't have to stand on the chair. And all she's going to do is she's going to hold the ball right over my chest here, and what I'm going to do is she's going to drop, as she drops the ball, I'm going to absorb that impact again, and I'm pushing it back up so she can catch it, okay? So these are just ball drops, okay? And again, we're just working on, I got it. So again, that exercise is really good if you're trying to develop that defensive. You've got to absorb that impact, and you also have to go ahead and force your upper body, so it's a good exercise to use as well. Okay, so we did power drops. Now the other ones are the two lower body exercises, and those are going to be good, again, during preseason for the powerful leg movements you need to go ahead and, from an offensive position. So the first one's called a squat jump. So if I get down here and I get into a good squat position, and then what I'm going to do is I'm going to explode through the hips and then come back down. Okay? Explode through the hips and come back down. So again, this is a powerful movement. So you want to sit there and go as strong as you can through. You want to try to touch the sky. And we'll do, repetitions probably around 6 to 8, multiple sets. And then the split jumps is just, instead of being in a traditional squat position, you're going to be in a stagger stance here and split. So we're going to go here, and it's the same thing. We're going to go here, we're going to jump, and split in the other position. Almost lost my balance there, okay? So we'll go here, split position, okay? So that's another one, again, working on the lower body power and explosiveness preseason. All right, so as the season comes, and we're already in season for wrestling, this is the time when you want to work on strength maintenance. and do exercises to do that. And you typically integrate more circuit work, circuit training. So the demonstrations I have for this is this first upper body exercise. It's called a single arm dumbbell row, and it's in a push-up position. So again, this specific type of exercise where you're doing a press position here is going to help you in that defensive position, but also now you're going to start working on the grip, and you're going to start working on pulling motions. So when you grip your opponent, when you have to pull a leg in or pull an arm in, we're going to work on that. So we're in this position, push up, and you can have legs as far as you want, as far as a good base. You can put them as narrow as you want. But in a push-up position here, you're going to row and put the arm back down into a push-up position. Okay? And again, you can modify your leg width when you do that.
Can you demonstrate that going this way as well?
Yeah. So in this position. Good thing I eat my dinner tonight to get my energy. And we're around. Okay? This next one is a little advanced, but I think that in a lot of your high school wrestlers, they could tolerate something like this. You can either use a lighter kettlebell or you can use a dumbbell for this. And what it is we call it the sweeping with a leg position on the, it's called the Turkish get-up, or the TKU. And the way we do this, excuse me, is we'll start in a position where I've got my weight supported on my hand, the kettlebell or the dumbbells in one arm, one hand, and the same side legs bent. And what I'm going to do is I'm going to hold this here, and I'm just going to let the weight kind of pack my shoulder. And then what I'm doing is I'm going to go up into a bridge, and then I'm just sweeping my leg. And holding, because again, I'm putting pressure through my left hand in this case to support my body, and then I'm going to bring it back. Okay, got caught up there a little bit, but that's okay. Okay, so that's what we call the single arm, or the sweep, the leg position. Okay, and again, just working on being able to have good control on the shoulder on this side. Absolutely got to work on core. You've got to work on your mobility through the hips. And this side actually is going to work on sustaining that position of the head. One arm med ball push-ups. So if we were to take a medicine ball, and most of these ones where we're like in this position, again, I keep going back to that takedown position where you're going to try to fight off your opponent as the defensive wrestler. So now, I get in a push-up position, I do a push-up, I come back up, and I roll the ball into the other hand. And again, these, they're not easy exercises, but they're very effective if you want to get that training, and especially if you do this in a circuit fashion.
David, can you do that one facing the camera?
Yeah. Facing this way?
Mm-hmm.
Yeah. So you go ahead and do your push-up, swing, hit the other side, and just alternate. It's fun. Okay. Glad we're done with the upper body stuff. Okay. Woo. And then in-place jumps, what we're going to do is we're going to stand here, and our goal is circuit work, so it's not getting into that full squat jump we did before, but it's just in-place jumps, just working on repetitive lift jumps. Okay? You do that in a circuit because you're going to do like 20 of these. And then you circle around through the exercise we're doing in this series. Lateral rotational line jumps. So if you had a line here, and I could use that as my kind of like goal to go over and back. Okay? Over the line. Now, You've got to work on side-to-side motions, but you also, remember, earlier in our talk, we talked about one of the risk factors was that rotational stress in the knees and ankles. So you not only have to go side to side, you got to be able to rotate too, and land with that rotational force, okay? And then plyometric split squats, it's similar to like that split jump or the scissor jump, but you've got to make it quick and explosive. Not a lot of time on the ground, so you split, and you just repetitively be explosive and fast. It's not as slow as the previous exercise, which was a split jump. Okay? Now, I need a towel. Pardon me. Okay. Hope I get some good questions about those exercises. All right. And so I think what the next slide I had was, because these exercises and these strategies we use are going to, we answer that question about, well, what are the strategies we use to prevent these injuries? So now it's our summary. Thank you. We got caught up on trying to advance this stuff. So what we want to do is we'll summarize what did we talk about. We talked about the big 4 factors that are involved in increasing risk. One, we know it's that toe jump position. We talked about it throughout the talk, where that defensive position really gets you in that kind of like not bad place. That was sometimes good. The live wrestling. Again, if you can use in practice, do more percentage of technique work, less live wrestling. I know that to a lot of wrestling coaches are like, what are you talking about? We have to live wrestle because how else are we going to get better when we get competition? I'm not saying you have to eliminate it completely. Just think about like your ratios or your percentages and just say, maybe we can move the pendulum a little bit more toward technique work, still doing live wrestling. Areas of body under stress, we talked about the head and neck, very vulnerable to injury. And it's like any other sport. You're going to have incidents for injuries. You're going to have a risk. So we can't prevent everything, but what we are doing is we're going to try to minimize that risk. So we have those areas of stress. We've got the head and the neck. We've got the shoulder that we talked about. And we also have the ankle and knee. And we also talked about the equipment. You have to have proper fitting headgear. You've got to make sure that you have mats that are new and clean. And you also have to make sure that your shoes are fitted properly, wrestling shoes. Okay? And then the second part was the strategies. How do we mitigate injury risk? And that is participate in training. If I can just drive home one point tonight, it's training. We've got to be training. And that's participating in the preseason explosive power program. Then once your season starts, we work on maintaining as much of the quality of strength you can have, as well as the conditioning part, which is you're working on your circuits. Okay? And again, you can do this before practice. That's typically what I've seen in with wrestling and with my other sports, is they'll do some of their work, their training, and then they'll go in and do their practices. And then, we talked about conditioning. All right, these are just references I used.
It's only 7:30.
It's only 7:30. Man, I'm good. And this is my special thank you. I promised a group that I would put this slide up, and I have to explain it. This is a picture of my father. He's the individual on the right. In the picture, yes, he was a professional wrestler. So that's a picture of my father and his good friend who I knew. He is unfortunately deceased as well as my father. They were the World Tag Team Wrestling Champions. So I promised them I would put that picture up and put a shout out to my pop. So First, I wanted to ask if there's any questions about what we talked about, and then we can get into the bonus material.
Okay,
We have a live question.
okay, here's my question
Yes.
about the preconditioning. Suppose you have wrestlers or players that are, let's say, out for football.
Yes.
They're out for, let's say some of them want to run cross country to get in condition for wrestling. How do they do that pre stuff when they're only allowed to spend a certain amount of time? And sometimes it's a lot of time in football or cross country.
Well, a lot of times you're absolutely right. You're talking about those fall sports. A lot of football players I've seen transition from football, depending on how far they go in any playoffs. Wherever you're playing football, if you're going deep into the playoffs, then you're absolutely going to lose out on some of that work that we would be doing with the wrestling team. But that's one of those things that I think we just have to kind of like do our best at. In football, we finish football, and then once we transition to wrestling, we want to try to get at least a certain level of wrestling conditioning, because we all know that sports are different as far as what level of conditioning you need. So my best advice on that is, because it happens, is you just do your best at trying to like get a little bit of that sport conditioning out of the way before you actually get into like do some of the like matches and stuff. Again, if your football team, I don't want to say it's lucky, but if your football team doesn't have to go deep in the playoffs, you get a little bit more time to play with. And the same thing with cross country. I actually see that less. It's interesting that you brought that up, but I see that less actually. But I'm sure you could run cross country and then go off to wrestling. So that kind of answer your question. I mean, that's a great question, and I've heard that from a lot of professionals, just sports training professionals, talk about that same topic. It's hard. It's hard to manage. You've got someone who's transitioned.
Plus the wear and tear on the body from football, right in the wrestling.
You really don't get a down period where you're resting, because you're going straight into you're going into a collision sport, into a combative sport.
So we don't have any questions online right now,
Okay.
but I'm going to ask a question about warm-up for wrestlers. As a martial arts instructor, how should this group be warming up for practice?
For wrestling, I think that, and before we started our presentation tonight, wrestling's one of those, being a combative sport. It's a sport in which you've got to make sure your body can get in really weird positions. So my best advice on trying to get prepared and warmed up is to make sure that we're, first doing something. Usually if you're in the wrestling room, you're going to have to do something to kind of increase the heart rate a little bit. So I remember when I was wrestling, what we would end up doing is we would end up taking some runs, but what we would do is we'd actually make it a run around because we had this huge gymnasium with all the mats. So we would actually make sure we raise our heart rate by doing like a run. And again, it's not like a sprint, but we're not just lollygagging, jogging. We're trying to get our heart rate up, because we've got to get it up there fast. And then what we do is we go through some warm-up drills. I don't know if they do these anymore. So, if anybody's out at home, they can comment on this. But we used to do drills where we'd have one person in a down position, but what we do is we kind of like do like a duck and cover when we're here. And then we would have the partner actually just on them, belly on their back, and they'd have hands behind back. And what they do is they just do like a quick rotation around their partner. I don't know if they still do that or not, but we would do stuff like that to warm up, because we have to get our legs warmed up. It's not warming your arms up, but we do, you do the traditional calisthenics to do stuff like that. We'd still get in and do it. There's nothing wrong with jumping jacks. I think that's a great prep exercise, It's kind of stuff like that. I don't think that wrestling is like any special, like a specific sport where you're like, oh, I've got to do this, to specifically get warmed up for wrestling. But you do have to make sure all your segments are warmed up, that you get good circulation going so that you can get in these extreme positions. Because when you're wrestling, you tend to get in those.
How do you feel about static stretching versus dynamic warm-up?
Well, as far as most of the sports that we work in and we train and we rehabilitate are, the big message is to do dynamic warm-ups. We want to make sure that we're moving the segments. We're activating the nervous system, because the brain is going to control everything we do. So we want to make sure we do more of a dynamic warm-up so that we can get the muscles activated. When you do these static stretches, they're good. I mean, to me, I think any exercise can be a good thing. But when you're doing static stretching, what you want to do is make sure that if there's a true limitation in someone's motion through whatever it is, their hip, their knee, whatever it is, you would want to work on that kind of like as aside from this dynamic warm-up. The dynamic warm-up should take precedence when it comes to preparing to wrestle or preparing to do any other sports you want. You want to make sure that it's more dynamic in nature and not just sustaining a position. Now, there are instances, again, that I tend to go against the grain sometimes. I think that sometimes there is a place for static stretching before you actually do other stuff, but that's in the rare cases when you've got really, really tight kids that are so wound up, and you may have to do a little bit of that. But for the most part, in most of the cases, it's absolutely most beneficial to do the dynamic warm-ups to kind of prepare. Yep.
Okay.
Did that answer your question?
Mm-hmm.
Okay. No questions from the
No questions
audience?
come up online, no?
Okay, all right. I thought that, I know we didn't take that long on this presentation, so let's do some bonus material. What do you think? So, this is good.
It will.
All right.
Very good.
So, bonus material, skin lesions. Remember earlier I talked about the mats. When you have your wrestling mats, you want them to be in good condition, meaning newer and not like cracked and all kinds of stuff. And you also have to make sure they're clean. So one of the things we talk about is skin lesions, these skin infections that wrestlers, get, they get. First and foremost, you got to understand the potential. There's a potential for infection when we're doing wrestling. The priority is the health of the athlete. That should be number one. That's above all else. Okay. When you're in doubt of any infection, don't avoid safety and the well-being of the athlete. It should be just paramount. Okay. These are things that you can look at. Like if you've got like these skin lesions that are raised from the skin, or do you have lesions that are kind of wet and moist? They're like, they're like, oh, pretty moist lesion there. Or if they have irregular borders on them, that's something to be concerned about. Okay. So now I want to play a little game. It's called Name That Germ. So, Coach, you
Ringworm?
No, good guess. It's a good guess. This is actually a really bad bug.
It's not impetigo.
No, this is really bad. This is MRSA. This is MRSA. And this is that bacterial infection. And it's very easily spread. And this is like one of the conditions, I think, not too long ago, I remember reading about it. There was a big outbreak of this in a local wrestling organization. So it's no fun, believe me. You can tell you've got the little pustules in there, around, in the middle there, without being graphic. All right, so next, let's see, Coach has got this one.
Okay, impetigo?
Yes, good job. So, the impetigo is another bacterial infection that you could get, and this is the kind of
That's contagious.
yeah, absolutely. The bacterial infections are very contagious, and this is that characterized by those the lesions on there, and it looks like honeycomb color. So that's no joke as well. And you're right, it spreads very easily. All right, and then sorry.
That's the ringworm.
Yeah. So this is they call it ringworm, or they call it tinea corporis. That's the proper word, but you're absolutely right. It's ringworm. So you can see that pattern that you would get there. All right, let's see what we got. Oh, this one, around the mouth. Anybody from home? This is herpes. Herpes simplex virus. So this is a viral condition, viral skin lesion that you will get. Okay. And then how about this one? This is a good one. This one, not too many people get. Not too many people guess it. That's kind of a weird name too. It's called molluscum contagiosum. Again, it's an alternate viral skin lesion. You had your herpes simplex, and then this is another viral condition that the wrestlers can get. And you get the little flesh-colored circles there. And the little papules you can see.
Now, if that's virus, how? You can't kill a virus.
Right, they have some antiviral medication, but the thing is yes, this and the herpes simplex is no joke. Like, this is something that the wrestling coach has to be aware of. You have to make sure that these athletes are thoroughly treated before they even think about coming back into practice. And again, I could, we can get like the names of medications for you if you need it. So. All right, 7:45.
The ringworm, that one is fungus, correct?
Yes, right there. Sorry, we showed 2 bacterial infections. We showed the ringworm or the corpus is fungus, and then we have the 2 viral infections that we mentioned.
Yeah. Are you done with this?
Let me just check again to see if there's any questions at home. We're wrapping up fairly early this evening. Give you a minute to type your questions here. All right, so I don't see any questions coming up. I want to thank everybody for attending this evening. If you do have any further questions, you are welcome to send those questions to me at sportsmedicine@mail.cho.org. You can reach out to me anytime. We look forward to having you attend some of our events next year. We are going to go primarily web-based, but we will do a few where we have a live audience as well. Please look for those flyers that are going to be coming out. Our first one in January is going to be for mountain bikers. So that's a new topic for us, but we've had the request for that topic, so we're going to make sure and cover that. Again, if you have any questions, you can reach out to me at sportsmedicine@mail.cho.org.
And may I just say one more thing? I want to thank everyone who's listening in on the webinar tonight. I want to thank the crowd here live. And it's been a pleasure to discuss this topic with you. And like I said, I'm really passionate about doing what we do here in the Sports Medicine Center. So if you have any injured athletes, you know where we are, hopefully. Okay? Thank you.